As we were saying in our headlines, the number of cases of esophageal cancer in men has doubled in the last 25 years. It's among the 10 most common forms of the disease. Cancer Research UK says that bad diet and obesity could be to blame. Mike Sargent reports.
It's one of the hardest cancers to detect or treat and an increasing risk for men. Esophageal cancer, or cancer of the food pipe, is the 9th most common in the UK. At these research labs, they're trying to find out why. And the rates for men have risen dramatically over the last 25 years. In 1983, 2,600 men were diagnosed with the cancer. By 2007, that had almost doubled to more than 5,000. During the same period, esophageal cancer rates for women only increased very slightly. So why the big leap among men?
It's really difficult to pin down exactly why cancer rates increase or decrease, but the most likely candidates in this case are the rise in obesity, also possibly decline in consumption of fruit and vegetables, and maybe also a bacterium that's linked to esophageal cancer as well.
Esophageal cancer rates are said to be increasing faster here than in many other Western countries. Cancer Research UK says it wants to be sure of the underlying causes and find ways to improve the treatment of this dangerous cancer. Mike Sargent, BBC News.
Well, with me in the studio is Jessica Harris from Cancer Research UK and Larry Rees, who was diagnosed with the disease 4 years ago. Very good morning to you.
Good morning.
Larry, first of all, what happened to you? What symptoms did you have?
I was sensing that as I swallowed, things were getting stuck in my food tube. And that went on for a couple of weeks, and I thought, this isn't right, I better go and talk to a doctor.
And you also had acid reflux, didn't you?
Earlier, yes, much earlier in my life, I'd suffered with acid reflux, and I thought it had gone away. But as I've learnt since, it sort of just goes a bit dormant on you because the cells change in the esophagus.
And Jessica, are those typical symptoms?
Absolutely, and difficulty or pain when swallowing is one of the really key symptoms of esophageal cancer, and it's really important if you do notice anything like that you go and see your doctor. But in general, anything which is out of the ordinary for you, if it's a persistent or an unusual change, then it's a good idea to go and see your doctor.
And it's interesting, the acid reflux, isn't it? Because I think all of us could say at some point we'd had heartburn or acid reflux.
Well, that's absolutely what it is. Acid reflux means when the acid that's in your stomach comes back up into the esophagus and causes the pain that we know as heartburn. On its own, that's not dangerous because many, many people, as you mentioned, have this very regularly. It's when it goes on for a really long time. In some people, it can lead to a condition that's called Barrett's esophagus, which is where, as Larry mentioned, the cells change inside your esophagus. And over time, in some people, that can lead to cancer.
You must have been quite shocked, Larry.
Yes, I mean, your life changes at the moment that someone says, I'm sorry, you've got a tumour, but you very quickly have to adapt to what's going to come next.
So what was the treatment for you, and what is your prognosis now?
Treatment-wise, first of all, they sort out lots of tests so that they can actually find out, you know, how far along you are in terms of the tumour, and then chemotherapy to try and reduce the tumour, and then a very aggressive surgery, which takes out most of your esophagus and most of your stomach and lots of lymph nodes and things like that.
So what effect has that had on your lifestyle then?
It's eating and drinking is very different. You know, I can't sit down and have a 3-course meal, which is normally what we do when we go out and socialise. I have to sit there and just have maybe 1 course and eat it very slowly, and I eat lots of times a day, so I'm a grazer.
You make up for it.
I certainly do.
You look very well.
Yes.
What's the long-term prognosis?
I'm 4 years out, and I'm doing very well. There's been no signs of any recurrence for me, and so I consider myself cured. And 5 years is the magic number that everybody looks at. So hopefully within a few months,
I'll be
all clear.
Jessica, why is this becoming more prevalent, do we think?
Well, it's difficult to be sure about the reasons behind the increases in the number of cases that we're seeing, but it's likely that the fact that we're so much more likely now to be obese or overweight is behind it, at least in part. Also, things like smoking, drinking alcohol, and not eating enough fruit and vegetables can also increase the risk, but they increase the risk of the disease and by no means dictate whether or not you get it.
Is it the figures, do you think, skewed a little bit because perhaps diagnosis is better now than it was maybe 20, 30 years ago?
Well, diagnosis does improve over time, but we do know that there has been a change in the rates of the risk factors for the disease over time, particularly in terms of numbers of people who are overweight or obese. That's really gone up.
Why men, though? Why particularly men, do you think?
Well, it's interesting, actually. We're not entirely sure why men are so much more likely to be diagnosed than women. I mean, we do know that men are more likely to be overweight, but that's not going to account for all of the difference that we're seeing between men and women. So it's possible that there's some unidentified factor at play that we just don't know about yet.
And smoking, of course.
Absolutely. Men are more likely to smoke as well than women.
Larry, you're looking quite trim, actually, I have to say. Were you overweight?
No,
Were you a smoker?
I was never overweight. I had been a smoker in the past, but I'd given up many years before my diagnosis.
Would you, if you'd known that there'd been the possibility of this in your life at a future date, would you have changed your lifestyle? Is it worth people actually thinking about what they're doing to their bodies?
Of course. I mean, I think there's general awareness today that we all ought to look after ourselves a little bit better. The scientific community is able to guide us much more closely these days. I wish I'd done something about the persistent acid reflux.
Did you ever mention it to your doctor?
Never. I just used to take the liquids and the tablets that
which we all do. Yeah. And is that the key, Jessica, going early, even if the doctor's just going to be aware that perhaps you've had a little bit of acid reflux and says, actually, don't worry about that, that's okay, but it's on your notes somewhere?
Yes, if it's going on for a long time, it's really important to see your doctor, even if it's something which seems quite common to you, because if it's going on for a long time, then that actually means something in itself. If it doesn't go away of its own accord, it means that something might be wrong, and your doctor will want to know about that. They'll be able to follow you up over time and see whether or not you're getting better. And if not, they might think there's something up and they need to do some further investigations with you.
And is esophageal cancer one that, if caught early, you can be successfully treated to some degree?
Well, as with most cancers, when it's caught early, treatment is easier and it's more likely to be successful. Of course, people with advanced cancer do survive, people with early stage cancer do survive, but in general, on the whole, when it's diagnosed early, treatment's easier and it is more likely to be successful.
And Larry, when do you reach that 5-year mark?
Next June.
Okay, best of luck to you.
Thank you very much.
Okay, Larry Rees and Jessica Harris, thank you very much indeed. Thank you.